So the City Health Department now advising New Yorkers wear masks while at indoor public places and in outdoor crowds. The advisory comes amidst the emergence of new COVID mutations.
Yeah, the health department's last weekly average shows more than 15% of tests are coming back positive. And there are more than 3,700 new cases every day and 87 hospitalizations.
So the best way to protect yourself still to get fully vaccinated, but masking now the recommendation in our city once again.
Family medicine Dr. Eric Ascher of LenoxHill Hospital is here to talk to us about it. Dr. Ascher, welcome and thank you so much for your time.
Thank you for having me this morning.
Absolutely. So talk to us about these masks, especially indoors. How protective is it, considering some people are going to be wearing them and some people aren't?
Masking is so important, and it's one of the most important things that we can do to prevent the spread of COVID-19. Masking indoors, especially if it's a good quality medical grade mask, an N95 is always preferred as a means of preventing droplets from infecting other people and from their respiratory droplets infecting you.
Let's talk about this new Omicron variant, okay, because this is what's really driving things. We're hearing about parts of Queens. We've got infection rates over 25%, and that's not taking into account the fact that people are doing so much of this home testing. How bad is it? How bad can it get? And I know this is a little bit of a prediction, but can you give us some perspective on that?
Yeah, absolutely. And, you hit the nail right on the head. With the increase in rapid testing from home, we really don't know what the positivity rate is. And anecdotally seeing patients every single day, new COVID cases and long-lasting COVID cases, we know that this positivity rate is on the increase. And I expect within the next couple of weeks, it's going to continue to increase until people actually take these masking mandates really seriously.
And Doctor, how significant are these new subvariants? We've been hearing so much about this BA.5 variant.
Yeah, the BA.5 is super contagious, incredibly contagious, why masking is so important. And we also know that those who had previous illness of COVID-19 and even those vaccinated are still experiencing mild symptoms. They're infected with COVID, much milder, but it's super transmissible.
And the issue goes back to anything that we transmit as carriers when we get sick. We don't know how it could impact somebody that may be a little bit more compromised. At this point, though, it seems that each variant gets better and better and better at being transmissible. Is that what we would expect from the way an organism like this develops?
Yeah, the way that the COVID-19 trajectory has been thus far is we are seeing it turn into a milder virus, which is excellent, but we still don't know how long COVID may affect some people. And like you said, we don't know if we're going to infect somebody who has a weakened immune system who may have a severe COVID case.
And Doctor, let's talk about testing here. The City Health Department also recommends folks should test themselves before or after traveling or going to any gatherings, right? But how reliable are these at-home tests?
We are seeing a lot of false positives and false negatives with at-home testing. The gold standard is still the PCR test that you would get from an urgent care or your primary care doctor's office. However, any testing is better than no testing. So I'm suggesting all my patients to take those precautions, test prior to going because you can be asymptomatic and we don't want to continue the spread and the creation of new variants and strains.
And talk to us about the hospitalizations on the higher end of the spectrum where people are really being impacted. We're seeing hospitalizations go up again at this point with this variant that we're dealing with?
Absolutely. We're seeing hospitalizations increase. Still nowhere near where we were at the peak of pandemic 2020, but we're seeing folks still hospitalized, and the majority of those folks are unvaccinated. So vaccination is still very important.
All right. Well, Dr. Eric Ascher from LenoxHill Hospital, thank you so much for your time and your perspective. We appreciate you and all the work you continue to do.
Thank you.